Hey there, welcome back to this massage tutorial on the rotator cuff. As you remember, the rotator cuff is the supraspinatus, infraspinatus, teres minor, and subscapularis. Today we're going to talk about the teres minor and this tiny little muscle that can cause a mighty punch in what's going on for somebody's arm or chronic shoulder issues. I think one of the best ways to figure out what's going on with the teres minor is to make sure that you palpate all along the lateral border of the scapula. So you're getting a little bit of the lats in there and some teres major down more inferiorly. But as you can see here, if I take my left hand and pull down on the superior angle, it allows me to palpate into the teres major and the teres minor as I get closer up into the armpit, and move it around a little bit to see where there are any adhesions, where there are any blocked fibers, and maybe what's going on any other level that I want to figure out what my next plan of attack is. It's incredibly important to distinguish the lats and the teres major and the teres minor all from each other. So the first thing I'm doing here is grabbing the lats, and then as I move up and a little more deeply, I'm going to palpate the teres major, and then going farther up, closer to the armpit, I can really get that teres minor and isolate it right there and start to make sure that the work that I'm doing is specific to that muscle. Once I've isolated the teres minor, I like to approach it from both the anterior and posterior aspects. So I'm using both my hands here, and as I pull it away from the scapula, I'm starting to manipulate it and giving a little bit of a torque so that it releases not only from the scapula but also from the teres major above it, and freeing it up so that it has a little more movement and I can start to figure out a little bit more about what's going on. If I find anything on the posterior aspect, I can use my thumbs here and push those fibers away from the scapula. And then conversely, if I find anything on the anterior aspect, which I think is actually a lot more common, I'm going to use my fingers and I'm going to pull the scapula up and away and make sure that I'm on that edge of the teres minor. It's really easy to confuse the teres minor here with, obviously, it's more superficial muscles, or to slip under into the subscapularis. But again, as I use my fingers, I'm pulling the scapula up and I'm hooking right into that edge of the teres minor and releasing that and allowing that shoulder a lot more movement with the release of this muscle. As you already know, breath is incredibly important when you're working with a muscle and trying to let something open up. So as I'm working on this anterior aspect and I'm holding with my fingers, I'm actually leaning back, and you can kind of see that I'm slightly rocking side to side, and I'm doing that with my client's breath so that as they breathe and they inhale and exhale, that muscle starts to let go on a very deep level. What I'm going to do next is an active form of a pin and stretch. The teres minor does lateral rotation, so as I hold down the teres minor, I'm going to have my client medially rotate their shoulder. So approaching their arm back up to the table, and as they do that, I can feel the teres major contract, but I'm going to avoid that, sink into the teres minor, and let it stretch as I pin it down. And this is a deep, deep release. So again, I pin the anterior portion of the teres minor here, and I have them medially rotate their shoulder, and then as they let go, it lets go at a very deep level, and I sink in and get those deeper points of pressure and those deeper trigger points that are hiding and causing a lot of constriction. One last technique I'm going to do here is another combination of a pin and stretch and an active release technique, just a little different version. So this time, as I pin down that teres minor, I'm going to have my client laterally rotate their shoulder and then also bring it up above the table so that it's lengthening that teres minor out. And as they do, I'm really pulling against those fibers in the opposite direction down towards their hip, so that that muscle starts to really lengthen on yet another very deep level. And once this happens, we get more nerve flow, more blood flow, more lymph flow, and that shoulder becomes a lot more free. Thank you so much for watching. I hope that this video adds to your bag of tricks, and you guys rock. Thanks so much for supporting my channel. If you haven't subscribed, please subscribe, pass it on, press the like button, and thanks again.